For those of you that don't know very much about us other than the flyer, we're basically the Tranquility program. So we are actually an intensive psychiatric outpatient program that's run through our hospital here, so BHI. What we do is we cater to those who have Medicare, which basically are those that are elderly and those who are disabled. We focus a lot on group therapy, as well as different modalities of therapy, as well as maybe some medication management in addition to that. So what that means is when patients are referred to us, when they kind of walk through our doors and are interested in what we do, we have them come in, we poke and we prod them, we ask them a lot of questions, and we try to figure out a really good treatment plan for them. Obviously, we want them to have a good kind of social system within the group therapy aspect. We try to supplement that a lot of times with individual sessions, as well as bringing family members or loved ones in to help them understand what's going on as well, and really put a lot of our heart and soul into what we do. So usually what ends up happening is for me to earn my keep, the staff makes me stand up here every so often and do these talks, which I'm happy to do. But really the muscle and the soul and the true heart of the program are the three ladies standing in the back. So I would like to kind of turn the spotlight on them for a second so they can get credit where it's due. The first is Hawkins. She's our program director as well as our therapist. So everything that I just mentioned as far as group and family, couples, marital, all that good stuff, she is in charge of that. She kind of looks at the patients, tries to figure out what they need. She organizes them into groups and really runs the show. She, again, pours a lot of herself into it. There are probably a lot of days she wants to bang her head against the wall, but she nonetheless kind of keeps triumphing and she keeps coming to work with a smile, which we really appreciate. Second is Tabitha Rote. She's our in-house nurse. She is responsible for a lot of the connection and communication we have with primary docs. A lot of times when patients come in and they have very uncomfortable questions, either about their body or their medications or how they're feeling, she jumps at the chance to answer those. She does a lot of research on her own, and again, puts a lot of herself into making patients feel comfortable and welcome in answering questions. And I think Marsha's probably hiding somewhere.
In the kitchen.
Yeah, see, so she's trying to stay out of it. But Marsha, if you see her, she's in the blue. She is our unit secretary, and she, again, is someone who does a lot of behind-the-scenes work. She is the one who makes sure that all the I's are getting dotted, all the T's are getting crossed. We're staying legally minded. She answers questions about insurance, makes sure we get insurance coverage. So again, a lot of uncomfortable things that she makes patients feel very comfortable in approaching or asking questions. So hopefully if you see them afterwards have questions, you just want to know a little bit more, please feel free to stop any one of us. Again, this is something we really love doing. Hopefully it shows after the hour that you spend with us, and we're just really excited about doing this. So thank you again for coming. I'm going to go ahead and get started right at noon, hopefully get you out of here at 1 o'clock. So social media is a pretty vast topic. It's obviously something really fascinating, you can see by the turnout today. But it's really important to start with kind of a simple definition. So of course I Googled this. But social media, looking at the actual definition, is any kind of website or application that we're using to kind of create and share information, find ways of socializing and communicating outside of our normal kind of everyday scope. So a lot of you, when we kind of put these flyers out and it was getting out in the community, when I was going about my normal errands, people were stopping me and saying, yeah, this is really great. I think Facebook is a really big issue. And Facebook it's a form of social networking, but that's not the tried and true kind of form of social media. There's a lot of other different areas that we are using that we don't realize. So when we think about a little bit of the history of social media, you all remember this, right? It's AOL Instant Messaging. This was one of the first things when we started getting introduced to this idea. So if you're anything like me, when you see that up, you can kind of hear that modem kind of chiming in the background. You see a little running man pop up, and he's running, and then he connects to a lot of people, and the world is at your fingertips. This was something that really caught on. It developed in the mid-'80s, and then went on and became really popular. This was a service that we actually paid for. It allowed us to, again, kind of communicate pretty instantaneously because, as you remember, what built on that was instant messaging. So when this first came out, a lot of people started asking, why is this so popular? What is so fantastic about this? Well, really, it was helping us communicate. Remember, this was a time kind of in the mid-'80s, 90s, where we didn't have cell phones. A lot of homes didn't even have a computer. They didn't have a PC. So people were starting to implement this quite a bit in businesses. So instead of having your secretary call a business partner, waiting on the line, getting the message back to you, you could just go into your computer at work, get into AOL, and then have that little instant messenger part kind of popped up. So it would tell you everybody in the world like you were available. So if you ever had a question, if you ever had a need, you could just shoot it across and you would get an instant message back. So it helped with communication. It made your day a little bit more productive. Again, you weren't having to get out and in of your office asking the secretary to make phone calls. With more productivity, what happens are revenue increases. So we were getting more money. It was just really beneficial all the way around. And socially, what this did is it helped a little bit of globalization. When people started, again, getting computers in their home, and they were kind of done with their homework, done with work, they wanted to log on, it helped go into chat rooms. Hopefully everybody remembers chat rooms, where you could just go in, you could search a zip code, you could search an area topic, and then you would be connected to a lot of different people, not just locally, but all across the country. So you were meeting new people at a very faster rate when normally you couldn't. There was also the sustainability of relationships. So I remember when I was a kid, if you ever went to summer camp or a summer program, you made a friend who, say, lived in Cincinnati. Obviously, it was an outside area code. You weren't going to be able to call them up on the landline and run up a phone bill. Your parents probably wouldn't have liked that. So what you did is you got their username, you looked them up when you got home, and then you kind of made little IMing dates. So Wednesday, 7 o'clock, meet me. This is my username, find me, and then we'll just chit-chat. We don't have to worry about snail mail. We don't have to worry about running up a phone bill. So made it easier, and really all in all, it was super fun. This was a futuristic way that we were able to talk. We could be really creative. This is when some of the first acronyms started popping up. So like JK for just kidding, BRB for be right back, LOL. We had very primitive use of emojis. It was kind of like this competition who could develop the best smiley face, with semicolons and parentheses. It was just really, really fun and very addictive. So with anything in this country, when something takes off, when something shows that it can make a lot of money, people try to jump on that bandwagon. So when we look at the social media history of this, you see again in 1985, AOL took off and people were instant messaging each other. And then kind of when you see around the late 2000s, it starts picking up. There are a lot more companies that were able to just kind of spread pretty rapidly. This, if you remember, is because the BlackBerry and the iPhone and the Androids kind of came into play. People now didn't just have a PC. They didn't just have a laptop. They had a smartphone. They had something that they were carrying around with them all the single time. So when you had any free time at work, you could just pop it out, get online. There was a bigger need to have these applications, to have these websites at the palm of your hand. So again, people were building on this technology and trying to figure out how can they implement this in your smartphone. So what did that do? It ended up really, really kind of bumping up the usage. So when you look down at 2005, it was in single digits, the amount of people using social media, which is insane to think about this day and the age because everybody uses some form of social media now. And you can see that chart actually stops at 2013. So who knows what the actual percentage of SMU is per day, per demographic in 2018. But again, that just is a visual representation of how much it's taken off. So again, remember back in the day, AOL, they used to send those little CDs out. They were mailed to you. It was free, 100 hours. After the first month, you charge like $9.99 or $19.99, depending on what your plan is. But now, when we look at these kind of platforms, they're free. You just sign up. It's really great. You don't have to charge anything. Really, all you need is a smartphone or a laptop or a computer, which everybody already has. So the question starts to come into play as to how are they able to sustain themselves? We know that they have pretty big players. They have CEOs, vice presidents. They have a lot of people working for them. They have some legal oversight as well. They have general counsels. How are they able to pay all these people and still stay afloat? If any of you know the network of Twitter or Facebook, does anybody know what the network of Facebook is? Anybody take a guess? No takers. Almost $500 billion.
Oh, wow.
So, and that was in 2017. So again, how are they able to make this money? Advertisements. So what happens is when there's a new platform that comes out, they try to figure out how they can get the most downloads. So once they roll out with this great app, that's what they're watching. They're trying to see how many people are trying to download this and actually use it. How many times are people clicking on it? How long are they staying? They want you to to want them. They want this kind of addictive potential there because that's how they can take that information, give it to businesses, give it to marketers and say, look at us. You know, we have so much traffic on our site. Come with us, give us the big bucks, and we'll keep getting people to come and see your message. Think about the Super Bowl. We know like millions, if not billions of people watch this worldwide. How much do they pay for those 30-second advertisements? Because they know that their reach is so much grander if you take something within that little spot. So why does this matter? Why am I talking about all this when we're talking about mental health? Why are we talking about this when we're talking about just daily social media use? So, the filter bubble. Show of hands, how many people have heard about this here recently? I'm not going to pick on you, so you can just raise your hand if you've heard of it. Okay, so this is something that's actually been in the news probably since post-2016, kind of coming on the heels of the election. So what the filter bubble is, it's an algorithm that a lot of these platforms are using. What they want to do, obviously, how many people have a Facebook account? Yeah, okay, great. So Facebook, if you remember, when you're setting up a profile, they're going to ask you your name, they're going to ask you your email, they're going to ask you your gender as well as your date of birth. Did you know that they're also getting your IP address when you go in there? So with the IP address, they're able to get a very basic geographic location of you. So for me, it would be, okay, so this is a mid-30s female who lives in rural Kentucky. So what they do, what this filter bubble does, is it starts kind of compiling this just basic, very random sketch of you. They're trying to figure out what you like. So what they do from there is, and what we do to help them is once we have a profile, what do? We kind of go and we explore it. We maybe add a few people, maybe your sister, your mom, your cousin, maybe you add a few public figures. So if they're celebrities, if they're athletes, if they're politicians, but you're giving them information about what makes you tick, what you find interesting, what really kind of turns you on. In addition to that, with a lot of these programs, there's an ability to search. So you can say, you know, I want to know about Breck County schools. So they kind of look at that, and they're looking at what you're clicking on. They look at what you click on and get out of immediately. So they're able to figure out what kind of offends you, what you don't like, what maybe you just don't really agree with, but then also what really is shiny and glittery and fascinating to you. And so it starts separating that out. It gives you all the stuff that's going to really keep you on longer, which means more money for them. So again, like when I present this to patients, the ones that I kind of feel like, okay, maybe you need to cut back on your use, and I bring this up, a lot of the kind of argument with this, well, I can drive down Old 60 and I can see 3 different advertisements for physical therapy, but it's not going to sway me one way or the other. It's not going to influence my buying. It's not going to influence my life. So again, it begs that question, why are we bringing this up in a mental health discussion? Well, it really is because of this. We know too much of a good thing is not necessarily the best for our brain. So when you look at the cycle of addiction, again, this is something that we've all been reading about here recently, particularly with the opiate and opioid epidemic. When you look at addiction, a lot of it is based off a trigger. So in this particular slide, it shows that it's an emotional trigger, but sometimes it can be just you don't feel good. There's some pain there. But all in all, there's something that just doesn't sit right with you. You feel bad. You feel gross. So what happens is we kind of want to be comforted. Basically, that's reinforced by some ritual or habit that we've developed over a lifetime. So for little kids, sometimes if mom pets their hair a lot, when they're uncomfortable, you see them twirling their hair, because again, it's a calming thing. So with drugs or substances, what happens is, again, there's this habit that's formed. It recircuits some of your brain. And so when you start feeling bad, you crave it. You really want maybe a shot of alcohol, because you know that you're going to get immediate relief of that. Upon immediate relief, if you have some bad consequence, or maybe you just feel your own guilt, you're going to have a pretty nasty kind of fallout from that. You're going to have some guilt, some bad feelings, and then it starts to cycle all over again. So that's with drugs, but, oops, does it say? It's Instagram, okay? So another form of social media. I use this essentially to kind of give an example a little bit of our bad days. So again, it's Wednesday, it's hump day. It's, you kind of got a few days under your belt, but, you still have 2 days left of the week. So say this morning, you go to work, you have a presentation, you kind of fumble a little bit on the presentation, your boss kind of cuts you a bad look, but they never really outright say anything, but it just doesn't sit very well with you. So you come here, I talk too much and I ramble on, you end up being late, you get in trouble. And then Susan from accounting, you know, she just makes a really passive-aggressive comment. Doesn't really sit well with you. You start craving to go home. You just want to get in bed. You want to do what we call, I just want to kind of put my brain on autopilot. I don't want to think. I want to watch something really stupid. You know, I want something mind-numbing. So you go home, and the kids don't want to do homework. Your spouse also had a bad day. They don't want to hear about your bad day. You know, it's pretty crummy. You just want everybody to go to sleep so you can do what you want to do. So then nighttime rolls around, kids are asleep, spouse is in the other room. What do? You take a shower, you get in your pajamas, get into bed. What do we do at that point? Usually what we're doing is we're reaching for a tablet or we're reaching for a phone, we get onto Instagram. That filter bubble, unfortunately, is going to show you every single shiny, fun thing that really kind of gets you excited. It gets you happy. There's some funny animal memes. There's a few funny GIFs. Maybe you want to like somebody's post. Maybe somebody liked yours and gives you a little validation. You check Susan from accounting's Facebook and you see like she's really horrible in a picture. It makes you feel kind of good. And then you turn off your phone and you go to kind of like roll over and you realize it's 1 o'clock in the morning. You got to get up at 6 o'clock, get the kids ready, and go to work and present again. So you can see how it almost starts this addictive cycle that's rewiring your brain. And unfortunately, when we are really kind of marinating in very happy pictures, what it does is it restructures your brain a little bit to where now when you have a very normal day that's pretty happy, it just doesn't have the same effect. So you built up tolerance to things that make you happy. So what are some other causes for concern? I try to use, little memes to keep it entertaining, but it kind of goes back to instant messaging. You feel like you have the world at your fingertips. You feel like you're really connected, but all in all, who really cares about Jim in Maine? Kind of liking your new car, or Susie from, Seattle that thought your kid's backpack was cute. What's happening is we're depending more and more on people's likes and that validation you get, but we're really not focusing on people in our own family. We're not able to sit and look at our spouse or look at our kid and make that conversation. We unfortunately are very, very hooked onto our phones. So there's a lot of decreased communication within our everyday lives. In addition to this, there's a big need for multitasking. So for those of you that work for big companies or maybe even small businesses, maybe you're kind of business owners yourself, there's this ability now to advertise on these social media platforms. So people are using Instagram and Twitter and Facebook. And through this, there's a lot of back and forth between customers. So customers are coming in and saying, why were you guys closed the other day? Then you feel that need to instantaneously get online and respond to the comment to make it look like you were a very in-tune employee or business owner. So unfortunately, again, we're just not present with our actual family, with our actual friends. These last two are a little controversial, but it goes back to that filter bubble that I was talking about. So the skewed perception of reality, as well as kind of that increase in implicit bias. The best example that I could really think of were snakes. So we are humans. We have something in our brain that allows us to go off of our experiences about events in our lives to form, hopefully, well thought conclusions and making up our minds on our own. So if you think about, again, like when it was beyond civilization, we were out in the wilderness, and we looked and we saw a snake. So this was an animal, it didn't walk on 4 legs, didn't walk on 2, it just slithered around, it looked really weird. When it stuck out its tongue, it was split, right? It's designed to make you fear it. It has fangs, it just looks really scary. So naturally you're gonna stop, you're gonna look at it, maybe poke and prod it, you're gonna see if it bites, is it harmless? So if it bites you, that's something that's imprinted in your brain. It's something that's going to tell you, maybe not play with this, maybe not even try to bother it, and if it attacks you, you need to kill it. So that's ingrained in your brain, but as your life goes on and you experience more and more snakes, you may realize when I have a garden, there are certain snakes that kind of help control mice that may really help your garden grow. So you're able to kind of negate that initial idea of a snake. So with this filter bubble, what ends up happening is you have no ability, there's no chance for you to really second guess it. You're always going to get those negative things, those things that you don't like, out of your sight. So we develop a very egocentric world. We become kind of selfish. We're not as in tune with our neighbor who may have different thoughts, maybe have different ideas. So it's becoming harder and harder to understand one another. And I think probably if you look at the news, you can kind of see that being talked about quite a bit. So there's a little bit more divide. We just have to be a little careful when we are just looking at something and it's only good things that we like. We have to understand that there's a lot more variability and diversity in the world. So again, that kind of promotes some implicit bias, unfortunately. So medical consequences. This was, again, something when I was in medical school and doing my medicine rotations, and I don't know if Dr. Smith may also agree with this, but when smartphones came into play and also laptops were becoming a little bit more accessible to individuals, so really looking at the late 2000s, what we ended up seeing a lot in the office were people coming in who did not have like a factory job or they weren't cashiers, but they were complaining quite a bit of cramping in their hands. They were complaining essentially of trigger finger or carpal tunnel. And it was, at that time, I remember for us, we're like, well, what's causing this? You know, you don't have a job like this. This is not a very textbook kind of presentation. But really, when we started digging and we really started asking those questions, we realized people are kind of hunched over, just like that picture. They're hunched over, they're squinting their eyes, and they always have a phone. So their hands are always cramped. So we're seeing a little bit more of a rise in carpal tunnel as well as trigger finger headaches because we're squinting. That light in the back of the screen is not very helpful for us. But also it's disrupting our sleep cycle. So again, if you think back to when you were laying in bed looking at your phone, right before you go to sleep, when you look at that screen, it has a little bit of a blue light. It's very reminiscent of a sunrise. So what it does is it triggers your brain into thinking it's becoming morning. You need to wake up, you need to have more attention, you need to have more concentration. So when you put that phone down, you're ready to go to bed. Your mind is telling you need to get up and get going. So you have a little bit of what we would call early insomnia, which is basically tossing and turning until you fall asleep. And oddly enough, there's increased caloric intake and obesity. So again, a lot of times when I look at that kind of research, it makes me wonder, but if you ever look on Instagram and you're following kind of foodies or people that take a lot of pictures of food, what happens is we are constantly bombarded with kind of restaurant food, that's very high and dense in calories with very low nutrition. And I will be honest, when I was doing this slide, I probably spent a max of 10 or 15 minutes just going through Google images of food, and I'm pretty sure I ate pizza and ice cream that night. Because it tricks your mind to think that's what you really want, that sounds really good, ooh, I want to try that restaurant, because that's what it's designed to do. So just be aware. So what are some psychiatric consequences? Again, this is something that's been in the news a lot. It's been the forefront of a lot of our research. But it unfortunately predisposes you to higher risk of depression and anxiety. So again, you think about, I hate to bring up Susan from accounting all the time, but you look at her webpage, right? You look at her Facebook, you look at her Instagram account, and you see like all these really great pictures of her and her puppies, her and her grandkids, her and her extended family. But you know what? You know Susan from accounting's cousin. And he tells you that she forces everybody in the family to take those yearly pictures, and nobody likes her. So, you realize slowly that people's images that they're putting on their social media are not always factual. They're not real. They're just snapshots and little pinpoint parts of their day, parts of their life that make it look super, super happy. But in reality, it probably isn't. So I'm pretty sure if all of us really looked at our Facebook pages or looked at any kind of social media platform that we have where there are a lot of pictures, you can probably pick out at least one person from your list that makes it look super, super nice, but there's a lot of issues within the family. But unfortunately, again, what that does is it creates this environment that we're looking at really, really happy stuff all the time. But your own life, the shortcomings, the personal issues, the relationship faults. So what ends up happening is you look at all these other people and there's almost a sense of entitlement. There's this feeling of jealousy that starts kind of getting deep in you, where you're looking at all these people and you say, well, 99.9% of the people in this room are super happy. Why can't I have what they have? Why can't I be happy? I'm just like them. I do everything plus more. And then it really, unfortunately, starts spiraling you out of control when you just feel really bad. You feel like you don't have what everybody else does. And you can see how that kind of piggybacks a little bit on anxiety when you start saying all these things, well, what am I doing wrong? Maybe I need to do something, but you can never reach perfection. But you can see how we live in a very kind of photoshopped world. And unfortunately, there's an increased risk of isolation. This is actually something that we've had to deal with at our program, unfortunately, where Kara works so hard on some of our patients, and then she says, okay, so this weekend, you're going to go out and you're going to meet new people, you're going to volunteer, you're going to go to church, you're going to make friends. And the person's like, yes, I'm going to go. I'm really excited. They come back Monday or Tuesday. She's like, so what did you do? They're like, well, I spent 3 hours on Facebook. And you're kind of like, well, what do you, well, I chit-chatted with somebody, and they were from Texas, and let me tell you about their family. And they kind of go into this really long, convoluted story about this random person that they met on Facebook that maybe they kind of talk back and forth. But the reality of it is they stayed at home in their basement with the computer, and they really didn't make any human contact. But we start really believing that what we're doing is true socialization, but it really never takes a place of actual human contact. You know, right now we're all kind of sitting next to each other. As we were standing out there, people shook our hands, they put their hands on our back, we smiled, we laughed, we were able to engage physically, but you don't get that when you're sitting behind a screen. So it's not the same, it just isn't. So unfortunately there is that risk that we tend to see quite a bit. So a good example, again, other than Susan from accounting, is Brad and Jen. Forgive me for the dated pictures, but you know, back when the world was really good and Brad and Jen were together, you know, if you remember kind of towards the late 2000s, they started having their marriage was on the rocks. Everybody was so nervous and so scared about them. But then there were these wonderful pictures that came out when they were on vacation, and okay, they're gonna make it. They're kissing, they're hugging, we have all the evidence that they're gonna pull through. They're probably going to counseling. And then 4 or 5 days later, they file for divorce. So again, it just goes to show that things are not always what they seem, and you have to look at it with a little bit of scrutiny. So looking at it a little bit deeper, so real quick, how many things are up in that picture? Just few numbers. Don't look at it too long, because then you're cheating. 5. Okay, 5. Okay. Tabitha knew the answer. She looked too long. So basically, when I was doing this slide, I really went to Google Images, and I was going and going, and I was trying to, basically what I searched for was busy computer screen, because I wanted to give you an idea of like what we're being forced to look at on a daily basis. And I actually scrolled past this picture a dozen times, and I was like, no, it's just too simple. It's just too simple. And then the more and more I looked at it, I was like, no, actually this is perfect. Because there's actually 7 things on that picture. But what are some of the things that first pop out to you? What's what your mind grabs? Netflix, okay. So for me, it probably would have been Ray Donovan, just because it's like the biggest. But when you look at it, this is essentially a very good example of when anytime we log into any kind of form of technology or social media, the screen is trying to throw everything at you. Again, it kind of goes back to the advertisers. So this is actually from Apple TV, and if you were to log into Amazon Prime. So if you look at the very, very top right-hand corner, there's a news alert about the Chinese president putting sanctions on Korea. Underneath that is another advertisement for HBO to get it on Amazon, and kind of an advertisement in an advertisement. It's a show about Insecure, a show on HBO. Then underneath that is the actual Amazon Prime menu. Then it's the Ray Donovan. Then it is what your most recent apps that you went into. Obviously Netflix is kind of there because they probably were looking at it. And then underneath that is everything you've already downloaded, so other apps and games that are available to you. And then it's another ad showing you how to get news alerts on the Fire Stick. So basically what that's meant to show you is our minds are really kind of forced a lot of stimulus at once, which it really wasn't supposed to, other than a fight or flight kind of situation. So what our mind is trying to do is it's trying to grab everything in the situation and process and organize it and keep you on task. So we're seeing us as adults with well-formed brains having decreased attention spans. Again, there's this inability to plan and organize, and this is, again, something we have to deal with quite a bit when our patients are here. Frequently, they'll go up to Kara or me or Tabitha, and they'll say, I think I have dementia. You know, I can't stay on task. I think something's really wrong with me. I need to be put on a medication. And again, the more we get to know them, the more we realize, well, you're using multiple applications. Your brain is just not wired properly right now, because when you are going into the kitchen trying to make a turkey sandwich, you know everything that you're supposed to get, but then your brain is, again, programmed to look at it and say, the dishes are piled up in the sink, I need an extra paper towel roll, and the bread, I don't know where it is, and then I need to take out the trash. So you're not able to sit and plan out making a sandwich, but you're constantly distracted. So again, that unfortunately heightens a lot of people's awareness, and they think, I'm just demented, I need to be put on a medication. There's decreased impulse control. This is something we see a lot with our phones. Anytime we click something, it's instantaneous. How many of you go to work And if your computer is just delayed by 1 or 2 seconds, you think you want to throw it out, and you say it's going too slow, but it really is just 1 or 2 seconds delay. It's because, again, we want things immediately, and it's unfortunately hurting us. And then with all of this comes an increased risk of addiction. So that's with us. That's with adults. Again, we have mature brains, we have the proper connections, but unfortunately we're kind of rewiring it to want to work like a computer. But what about technology in our kids? And I kind of changed it a little bit because obviously social media is something we use, something the older kids use, but technology is something that we're actually kind of giving our kids because, well, that's the world that they're going to need to work in. They need to be able to survive. They need to know how to use this. So what are some things that we need to be careful about for them? So it essentially piggybacks and echoes a lot of our concerns with adults. We see a lot of motor development, a lot of postural disturbances. Again, if you think back to the picture of the adult who's hunched over looking at things, kind of squinting their eyes. If you have a little toddler who's just kind of literally toddling around, they're not really able to run and walk and maybe jump. If you're just handing them an iPad or a cell phone, more than likely they're going to be glued to that. They're not going to want to get up and run outside and play and do all of those things. So we are starting to see a little bit of a delay in that with children. Naturally, lower communication and verbal skills. A lot of times parents, like myself, will download these educational apps and think, well, this is great. We're just going to stick it in front of them on a long drive and let them kind of play around. They'll learn their alphabet. But nothing, again, really replaces that constant communication parents have where we are taking into context, we're looking at intonation, we're looking at tone, we're looking at rate, we're looking at body language, whereas our computers are simply just putting up a picture and saying A for apple. It, again, doesn't have that context, it doesn't have that actual interaction. There's a limitation of natural stimulus as well as that spontaneous creativity. So a good example is the game Hot Lava. You know, when kids are really bored and when it's a snow day, they put down pillows and they say, don't touch on the hot lava. They're able to kind of create these crazy games that are just made up in their mind, but it allows their mind to, again, just really expand and understand the world around them and apply it to games and kind of making puzzles and critical thinking. But we're losing that quite a bit when it's just passive learning from a tablet. Obviously, shorter sleep duration, like I said, with that little light blue light behind our screens. Increased risk of impulsivity, just like adults, as well as behavioral disturbances that we're seeing kind of once kids start school. So, with our older kids, so this is another little interactive game I have for you guys. This is something that I do a bit with parents as well as teachers. How many know all 5 of those? Our youngest guy in the room. Anybody else? No. Okay. So, does everybody know Twitter, Instagram, Snapchat? Pretty much. Okay, good. Does anybody use the green one? WhatsApp? So WhatsApp is a kind of like a texting app. It's not necessarily social media. It's just a way that you're communicating, again, via text. But rather than using cellular data, you're actually using Wi-Fi or LTE, basically your internet connection. You don't have to really worry about international stuff because, again, you're using internet. It hooks up with your phone book that's already on your tablet or on your phone, so you're able to shoot messages just like a text, able to link up media, videos, GIFs, all that good stuff. So it's actually pretty safe because you know who you're texting unless you accidentally put in a wrong number. Kik. How many of you guys have middle school kids, high school kids? Okay. Few. Okay. So Kik is actually a pretty popular thing that kids are using. So this, again, it's kind of like WhatsApp, and you can correct me if I'm wrong. So Kik, again, is really popular among younger kids, but unfortunately because of some issues there, they've made it 17 plus. So again, this is an ability that you can put in a phone number, or you can put in a username. It's kind of like IMing, where you're not necessarily using that phone number from your actual contact list, but you're able to communicate, send texts, send messages, and media. The problem with this is, again, just like IM, you can go in, you can put in a little subject, and then get connected with other people within that little realm. But it opens you up because there is some anonymity, that there's some child exploitation, some child pornography, that again, they've made it 17 and plus. So again, for those of you that may have the younger kids, you may want to check that phone just to make sure they're using it the way they should. So this is a little more difficult. It's meant to be. Does anybody know what any of those are? Good, I'm glad our youngest is kind of squinting like he doesn't know. So these are actually somewhat popular. So the one in the top right-hand corner, that's a hexagon with the lines in the middle, that's Bumble. So that's a dating app. It's probably good that none of you guys know about it, because it's basically just to hook up. But it's supposed to be 18 and older, but sometimes younger kids are getting on this, creating a fake profile, trying to be funny. But unfortunately, this again does open up the window for maybe some child exploitation as well as child pornography that we need to be a little aware about. The next one is a little bit of a misleader. It looks like Instagram, but it's almost like the negative version of it. Has anybody heard of Instagram or Finsta, Fakestagram? Okay, some. Okay. So it's not a real app. It's just basically Instagram. But for those of you, okay, so how many people have an Instagram account or kids with Instagram accounts that you know of? So quite a few. Good. So I'm sure for those of you that have kids that have an Instagram account, you probably know their handle, you know their password, you're looking at what they're doing, you're monitoring it. Well, kids obviously want to be sneaky. They want to hide stuff from their parents. So what they do is they set up a second Instagram account that their parents don't know about it. So if you ever hear a kid talking about Finsta versus Rinsta, Rinsta is real Instagram, Finsta is fake Instagram. It's a private account, so you can't really get into it unless you're a follower. It's usually a very few tight-knit circle of friends. So obviously, what are they going to do? They're going to post pictures that you probably don't want them posting, that you don't want them on the web. So underage drinking, maybe some salacious stuff, things they really have no business doing. So talking to your kids about that. The next one is Ask FM. This was actually an app that was developed in Latvia, Europe, and then went on to become pretty popular in the UK, and then eventually kind of somehow crossed over the pond into New York. But this was a really popular app. It was essentially Reddit for kids. Does everybody know what Reddit is? Or Quora? It's kind of a forum where people can go in and ask questions, and anyone from anywhere can answer it and just basically obtain information. So this is what it was meant for kids. So if you had a question about college apps, if you had a question about ACT, SAT, you could go in here, and it was more of a condensed kind of group of people using it. But what ended up happening is it doesn't take long for some of these things to become kind of perverted, where it became the site of a lot of cyberbullying. And unfortunately, in the UK, it was linked to about 8 or 9 suicides. So it did have a little bit more legal oversight to that. And then the last one is Groupme app. That is essentially texting, but through groups. Again, you can attach different forms of media. Kids like to use this sometimes for school if they have school projects. But again, it doesn't take very long for it to become something perverted, and unfortunately it is a site of a lot of cyberbullying. So I use this example quite a bit with parents and teachers to let them know that unfortunately we've created a world where it is really lucrative to have some form of messaging, some form of social media app on our phone. We like it, it's addictive, we use it a whole bunch for kids. If you don't use it, you're not cool. So unfortunately there are a lot of things we can't keep up with. We have to be able to have that open communication with our kids and try to figure out what are they using? What are they using it for? What's the latest download that you're using, and can I download it on my phone and play around with it? Things such as websites that I tell patients and parents to go onto is smartsocial.com, as well as commonsensemedia.org. Those are really, really great outlets for parents and teachers and anyone who has kids to look at, because what it does, it starts rating all of these different platforms, and it shows you what's safe and what's not, what things you want to look out for, what is it used for when it's kind of a bad thing. It lets you know what's being downloaded at faster rates, so again, it kind of goes back to that marketing. What's most popular? What are kids more likely to get on their phone? And then just having that, again, open conversation with kids. So I really want it to be clear that it's not all bad. I mean, obviously, again, when we look back at AOL and instant messaging and even how we use Facebook sometimes with our grandparents, it's a really great way to stay connected and to really stay up to date with a lot of things, but you just have to be careful. A particular thing with children is it's kind of giving them a voice. I know some of these are kind of polarizing, but I think everyone in this room probably wants their kids to have a voice and to feel like they can stand up for something that they really believe in and they can make a difference. So when we look actually back at 2010, 2011, during the Arab Spring, does anybody remember that? It was like nearly a decade ago. But this was obviously in Northern Africa as well as the Middle East, where there were a lot of authoritarian dictatorships. The younger generation was getting really fed up with this, and they were trying to figure out different ways to express their dissatisfaction. But unfortunately, in these countries, there was a lot of state-run media. They couldn't get a voice out. Nobody wanted to hear them. So what they started doing is they used Twitter as a platform to arrange and organize protests. So really, when you look at kind of the stats of that time, the highest grossing kind of like hashtags were hashtag Egypt, hashtag Libya, hashtag Mubarak. So when kids, again, would go into Twitter and search that, they would find out the latest meeting places, find out the latest protests, and that's how they were able to get numbers. You saw that kind of coming into our country, and then after Ferguson in 2013, when Black Lives Matter kind of came into play, and then after Parkland shootings during 2018, the hashtag March for Our Lives. So again, it's not all bad. Kids are using it in very responsible ways, and they're using it again to magnify a voice that they can't have otherwise. So what I'm saying really is use it responsibly. We know that, again, we're mostly using it to look at pictures and maybe keep in contact with friends, but we just really have to understand that it's not always as it seems. We have to really look at it with some scrutiny. Understanding, again, that it can have that addictive potential. It is kind of hurting our relationships as well. Avoiding the comment section. So this is actually something, NPR was one of the first news sites that started up a comment section, I want to say back in 2008. And they thought initially that this was going to be a great place where people can like share their intellect and look and analyze articles and really have a good place to, you know, discuss stuff, current events. But unfortunately, I think, I want to say 2016 or 2017, they did away with it because they're like, you know, it's just too toxic. It's just really nasty. So a lot of these news companies have kind of followed suit, but there are still some that have it. So just really avoiding that. If there are any negative comments on your feed, just try to ignore it, as hard as that is. Using technology more so for education rather than socialization. Try to make that coffee date with a friend. Try to really be a lending ear. Try to understand your neighbor, as opposed to just being on Facebook chatting. Attempting to utilize evenings to unplug. Again, reconnect with your spouse, reconnect with your kids, and really just avoiding social media use or SMU when you are with people is incredibly, incredibly important.